Hi, I'm Dr. Kelly Starrett with H-Wave. Today we're talking about how to use H-Wave high-frequency setting and its high-frequency technology to get some on-demand pain relief. Now, one of the things we're big fans of is helping our athletes and our clients self-soothe. For whatever reason, overuse, injury, trauma, chronic pain, it doesn't matter. It turns out a lot of the same solutions can help. How do we facilitate better healing? How do we facilitate sort of better health of the brain? Well, of course, we're always talking about sleep and nutrition and movement and feeling loved and safe, but also sometimes we know that we have a bunch of tools and tactics at our disposal to help the person feel better in the moment. And in the top of our list, in the top of our drawer, we reach for H-Wave. Now, the key here to understanding how to deploy this technology safely is that it's very, very safe and very, very easy to use. And if you understand the sort of the magic or the setup, then you can immediately tap into sort of the amazing effects of this on-demand pain relief system. So in this situation, I'm going to take on something that might be very common for our runners, and that might be a little bit of something that looks like runner's knee or jumper's knee. In this situation, we're talking about, hey, I've got some pain in this ligament. We oftentimes call this the patella, but this area between the patella and the insertion of the knee. So technically it's going bone to bone, so it's a ligament. But in this patellar tendon region, patellar ligament region, this can be a very sensitive pain spot for someone. And what we can do is say, well, how do I get some relief in there? Well, we know that we could use topicals, we could scrape, but one of the things that we realize that we can reach for is high frequency to give myself some immediate pain relief and lasting pain relief. So the rule of thumb is basically to put a pad on either side of the area where you want the relief. So in this situation, I'm trying to go after this painful, achy spot here. So I've just got a pad on either side. What I'm going to do is turn on the H-Wave. I'm going to select high frequency here, and then I'm just going to dial this up until I get a little bit of a comfortable buzz across. And suddenly, this area, actually, believe it or not, is actually numb. I can't actually feel this. And what that's happening is that for whatever reason, whatever the complex mechanisms are, which you don't need to go into here, I'm able to now immediately have some on-demand pain relief. And so what's happening is that this area is no longer sort of sending an immediate sort of threat signal to my brain, or my brain is perceiving what's happening in this area as non-threatening. And what's great about this is that I can keep this on, I can move, I can do what I need to do, but I'm simultaneously getting some pain relief. Our only rule is that, hey, we don't want to necessarily deploy this if someone has some altered feeling going on. If you're pregnant, obviously there's some good rules of thumb here. But basically, I can keep these two pads on upwards for 45 minutes to an hour. What I want to do is, if my first session, just look underneath and make sure I'm not having any irritation under the pad. We typically can run this upwards, again, for 45 minutes to an hour. This can give me some immediate pain relief. And the reason we want to stop that is we are putting some energy through the skin, so we don't want to be irritated here. But what we know is that when after 45 minutes to an hour, I turn this off, what I can have is an additional many hours of pain relief. So in this situation, this is unlike a TENS where I'm just kind of buzzing and trying to confuse. I'm getting this sort of very high frequency kind of technology energy going through the system that gives me this relief and gives me ongoing relief. So the way I might deploy this is now my knee isn't aching and I can fall asleep. Or, hey, after that big session, I just wanted to feel a little bit of relief for 3 or 4 hours, do another session. It also might be that, hey, my job is on the line and I need to use my knee. And so what I can do is give myself some pain relief and then go use my knee and come back and manage that. So if I'm not thinking of a specific tendon area, let's say that I just had surgery or I sprained my knee, I can think about actually putting energy right through the entire joint itself. So in this situation, I've got the pad on either side of the knee, and as I dial this up, suddenly the entire knee starts to feel comfortable. It just feels like a buzzing. If I start to capture too much musculature here, and I'm not on the just bony structures or skin areas, you can see that I can actually go into tetanus. So I can be recruiting enough energy that the muscle is into lockdown. I don't need to be in that situation. I can just set myself up where I'm right before I start to go into this tetanus kind of lockdown situation. And again, I can go ahead and move pads around so that I go ahead and reset, move pads around so that I can get a really comfortable sensation, give myself some relief in this situation for upwards of an hour, plus the sort of coasting effect that happens. The bottom line is now, once I understand how this works, I suddenly have a technique and a tool to manage a painful site, a spot, an ugly spot, pain in the neck, pain on my back. And basically I can use these pads anywhere where I'm like, hey, this hurts. I want to give myself some relief so I can fall asleep or move or do my job or just, whatever it is that's important to me. And I can do it without ice. I can do it without needles. I can do it without drugs. I can do it without, pharmacological intervention. And that ends up being a revolution in on-demand pain relief where I can do something safely and repeatably. I don't have to believe in it. It doesn't have any downstream effects. I can still drive my car. It's amazing how effective this is. When we can join this with non-fatiguing muscle contraction and low frequency simultaneously, we have a real mechanism to facilitate the body's healing. So remember, goal here is to be able to give myself some relief so that I can continue to move or continue to do my rehab or do my job, and being able to deploy high frequency in this manner, as it goes a long way to getting me back to doing the things that I care about.